Hi guys, this is John Adamson, the Rehab Documentation Guru, and today we're going to look at whether or not standby assist slash contact guard really requires the skill of a therapist to work with the patient. The reason I bring this topic up, which I've wanted to on a video, is because it is a hot topic in the area of denials. Those of us that are in the appeals management industry have been seeing a lot of denials in this area from Medicare. And the basic premise is this: the Medicare auditors are saying that the patient is already high enough level that a non-skilled person could handle their care. Now, one thing to note, this does not necessarily apply to a true outpatient setting. So for you guys who are an outpatient, you are addressing patients sometimes that are even better than this. They're modified independent, sometimes independent, but they have problems that prohibit them from doing some very high level functionality that I'm not really talking about right now. I'm talking about more of the basics: ambulation, transfers, bed mobility, self-cares, functional transfers, things like that. And so these are where we're seeing a lot of denials. And so one of the things you got to ask yourself as a therapist is, can you really answer what is it actually that is needed that makes the patient require you to be right there with them? Either there with them that you could catch them if they started to fall, or if they started to do something stupid, you can give them an immediate cue to do the correct thing, or if they started to lose their balance, or contact guard where you have to put your hands on them and just kind of guide them, but you're not really physically assisting them. It's just tactile input. What is the skill in that? What is necessary? And one of the things that you really need to do, you should be doing for all your patients, but this becomes really important with patients that are high level functioners, especially once they get past that min assist level and better. You really have to show standardized tests. And there's lots of standardized tests. I use this example in my course just because the TNETI is a very well industry recognized test, even by PTs and OTs. I'll have to do another one for speech therapists. But this is a test that pretty much everybody knows about. They've administered it at some point. And I'm going to give you an example of a patient. Please excuse, there's some cheeping in the background. There's this little bird that thinks I'm going to feed it. First of all, a patient is supervision for gait. And so technically, we're saying we have to watch them and closely. We could even be saying standby assist. So we have to be with them right there with them. Otherwise, they cannot perform the activity safely. But then we do a standardized test, and we find out that the patient scores a 16 out of 28 on the TNETI. Now, I can tell you, I saw a lot of home health patients where I did a TNETI at the beginning and the end. In the beginning, like especially orthopedic patients, they might have a total knee replacement, and they would score 14 or 15 out of 28 on the TNETI because of weight-bearing limitation and pain, but they would still be fairly independent, sometimes modified independent. So I was trying to justify me seeing them as a therapist. So in this case, even though the patient's only supervision, the TNETI says they're 16 out of 28, which puts them at a high fall risk, and also indicates that there's multifactorial balance and gait deficits. One of the things we'd have to do in that assessment, therefore, is to objectify all the deficit areas, and that would be really important. Now, let's get to the discharge. And let's say we saw this patient for a couple weeks or 3 weeks, and now we're saying they're distant supervision. So they were like standby assist supervision before, but now they're distant supervision. Is that really much of a gain? Well, a reviewer would probably argue, no, it's not. And a lot of patients we see can be limited in the area of just cognition, where it's not so much the physical function that's making them supervision, but something else. And in this case, this patient was cognitive limited, but they scored a 21 out of 28 on the TNETI. Now, one of the things that evidence-based standardized assessments do is they have what are called psychometric parameters associated with them. There are a lot of different psychometrics, like there's age normative data that can be very helpful. There is validity of a test for certain functional outcomes you're looking for. And one of the psychometrics that we can use is something called the minimal detectable change, which is the number of points gained a patient must have to prove evidence-based functional improvement. In this case, the Tenetti is about a 4-point gain for most patients to demonstrate functional improvement. Here we have a 5-point gain. So not only did we take the patient from high fall risk to moderate fall risk according to the Tenetti, but we achieved the minimal detectable change, and we can also objectify the particular areas of functional concern in gait and/or balance that the patient improved in. This would be further objectifying the vastness, if you will, of the gains you've made with the patient, where supervision to distance supervision or standby assisted distance supervision did not capture. So think about that. When your patient's high level functionality, standby assist, contact guard, what really makes them at that level? Can you really objectify that? Can you get to the nitty gritty? Can you demonstrate that your skills are necessary to take them to the next level of independence, which might not be much of a gain at all? And standardized tests are probably one of the best ways to do that. Again, this is John Adamson, the Rehab Documentation Guru. If you have any further suggestions for videos, please feel free to comment. Also, please like these videos and subscribe if you're not a subscriber. One of the things that does for me is eventually I'm hoping that the YouTube channel will be enough to generate a little bit of income. I know it won't be great, but a little bit of income to make the content continuing to come out for you, because this does take time and effort on my part. And I appreciate the likes and the subscriptions because that'll help get YouTube's attention. Anyway, you guys take care. Have a great day.